this is my basal cell carcinoma zeroed in target here.
Okay.
And we're going to do a Mohs procedure.
Okay.
And it should take about,
How many layers you need, so.
depends on how many layers I need. Praying to God that it's minimal.
Yeah.
Hey, I'm here with Dr. Joel Schlessinger.
Hi there.
He's been on many TV shows. You want to talk about which one so they can tune in and see you?
Absolutely. So we are on Instagram as Omaha Beauty Doc and at lovelyskin.com. So happy to be here with you, Deb, and I really want to let people know the importance of taking care of your skin like Deb has. And if you do see a spot that is changing, come to a dermatologist. So do we want to show the area that we've worked on? I don't know if people are ready, but there's a little hole in there because I've taken out a small specimen of tissue. There it is. And you can see it's got a little bit of bleeding. We're going to do some suturing in it so it stops the bleeding. But other than that, we're going to take good care of you.
Thank you. And the next step now is you're going to
We're going to look at that specimen under the microscope. So we're doing what's called Mohs surgery, a microscopic surgery during the time. And what we're looking at the specimen is to see the borders and see if they're clear.
and then once they're clear, we get 2 stitches.
Well, we're probably putting about 2 to 3 stitches in right now, and then we'll probably about 2 to 3 stitches when we close up.
So I'm lucky enough today to have 2 doctors on site with me.
Double trouble.
Double the trouble. But it's not because I'm double the trouble. Daniel Schlessinger is going to be going on a fellowship. So tell us about that.
Yeah, so right now I'm finishing up dermatology residency. I'm the chief resident at WashU in St. Louis, dermatology. And starting in July, I'll be going to Chicago to do my 1-year fellowship in Mohs and cosmetic surgery. So I will be training in specializing in Mohs surgery, which is a specialized year where we learn how to take the specimens, how to process the tissue, look at it under the microscope to ensure we got all of the cancer cells, and then reconstruct the wounds. The fellowship will also focus on cosmetic surgery, so injectables like neurotoxins, fillers, laser, and energy-based devices as well.
This is a really common procedure anymore, correct?
It's certainly on the rise. So skin cancer is absolutely on the rise, and when it's in a high-risk location like the head or the neck, then Mohs surgery is the preferred treatment.
Right. And a lot of people that we've heard about in the news lately have been having this, right?
Yeah, so I think both of the Bidens, both Joe Biden, Jill Biden, and I think Hugh Jackman recently had it on his nose.
Yeah. So don't think you're above anything else in this world, and take care of yourself. And thank you, Daniel. And
Thank you. And
wishing you the best of luck there.
thank you so much.
We're done with it now. You had 6 stitches, so 4 there, 4 inside, and those 6 stitches will be taken out in about 6 to 7 days, and we'll hopefully not have any recurrence of it. It only took 1 layer, which was very good. So 1 layer means that we got it all the first time around. The Mohs method, which is the most effective method for skin cancer removal, 96 to 98% chance of cure, is relatively easy. I think start to finish, maybe 2.5 hours perhaps, and that's a pretty good amount of time. We analyzed the specimen, looked at it under the microscope, and it was clear. So we get to let you go on home here today, Deb.
And I'm really excited, and my prognosis for healing is that I won't have any scar. It'll fade out, but if I do, you can laser it.
We can always do a little bit of laser work, but most of the time the laser work isn't necessary in this type of area because, as you can see, I kind of fit it in with a crease, so it will follow the natural curvature of your cheek, of your chin. So basically, the best thing that can happen in doing surgery is to make sure that you find a natural line that you can kind of camouflage it, and that's what we did here.
Excellent. Well, I'm so excited, and thank you so much.
You too.